So we've got the fantastic Alyson Dodd with us today. Alyson is part of the SMaRteN leadership team and has been boldly and bravely trying to complete a scoping review to look at how mental well-being is measured, both in the academic literature and in the grey literature. So how universities are measuring it, accommodation providers and such like. I think that grey literature bit is the braver bit of her work here. So Alyson, it's really great to have you with us today. I'm hoping you can give us a bit of a potted summary of the project and perhaps some of the headline challenges that you've come across in terms of thinking about how we measure mental well-being.
Yeah, no problem. So we did this scoping review, which differs, as some of you might know, from a kind of full-on systematic review, because it was quite a new question. We weren't looking to kind of comprehensively look at psychometric properties of specific measures or what kind of were the correlates of well-being using these measures. It was very much more what are people using to measure well-being and why, with that why typically being how do they themselves kind of conceptualize well-being, or what theoretical framework of well-being are they using. So this was a task with our student-led research team, our first SMaRteN student-led research team, and they selected that they wanted to look at well-being and stress measures rather than mental health, because obviously with mental health being so multifaceted, if you're doing a search in any kind of database or on the websites of relevant organisations, you'd have to search for depression, anxiety, eating disorder, psychosis, all those different sorts of terms. Although what we discovered, of course, is that well-being itself is hugely multifaceted. People use all sorts of different indicators of well-being. And I say indicators because some of them don't directly measure subjective well-being or psychological well-being or mental well-being. They might be something like resilience, which is kind of a linked construct, but arguably isn't a measure of well-being. It's something that might indicate that somebody is at kind of higher or lower well-being, if that makes sense. So this has been a big old project, as these things always turn out to be. And we discovered through our search of this grey literature, which was kind of relevant organisations such as Student Minds, the University Mental Health Advisors Network, Universities UK and so on, looking through any reports that they'd done and how they were measuring well-being, as well as searching academic databases in a more systematic way. And we found 25 separate measures, and it's worth saying that this was specifically in UK students. There's a lot of work being done in the States, and there's a lot of work being done in Australia as two particular places that come to mind. But because we're SMaRteN, we're focused on UK students, we did kind of limit the search to that, which is probably a good thing because it still came back with many, many, many publications to kind of whittle down. So I guess I might just say to the group, can you guess what was the one that came up the most often in terms of a well-being measure?
Warwick Edinburgh?
yeah, so unsurprisingly, the Warwick Edinburgh, like far and away, was used more often than any of the other individual measures I found. Of course, there might be papers that weren't included here for whatever reason, because no systematic review and search and screening is perfect. But it was, you know, about 20 times that was used in the papers we included, whereas others were used maybe a maximum of like 4 or 5 times, and then some only used once. So yeah, the Warwick Edinburgh. And the second one is are people aware of the GP core? So that's the general population version of the clinical outcome routine evaluation measure. Oh, is this frozen or?
No, everyone's very well trained to mute themselves, Alyson.
Oh, excellent. I just wasn't sure. Well, yeah, so the other one was the GP core.
The invitation. You can unmute. Answer me.
So that one, that was the second most commonly used, but not anywhere near as often as the Warwick Edinburgh. And this is unsurprising because those are the two only measures that have actually been kind of developed and validated with a view for use in students as well as the general population. So both teams of researchers have specifically looked at those measures in students, and in particular the GP core was driven by the development of a measure for suitable use in kind of cohort studies in students and in student counselling services. So not surprising. And then I guess the other more commonly used measures were very much based around, I don't know what kind of multidisciplinary backgrounds we've got here, but I'm assuming quite a lot, but they were mostly kind of social psychology, social science type conceptualizations of well-being. So what would be called subjective well-being, usually with that kind of cognitive evaluative component around how somebody perceives their life satisfaction to be, and an affective component around how are they actually feeling in terms of positive and negative emotions. And then I guess the final key point around the actual measures that we found, before I talk about any kind of wider discussions that we've got in this review, is that quite a number of people are using measures of psychological distress or of mental health symptoms as a proxy indicator of well-being, which again is unsurprising given the broader literature and given that we know that that happens a lot. But it wasn't unusual. And I would say that actually if you added together all of the mental health measures, they would take over some of the individual well-being measures, if that makes sense. But individual measures like the hospital anxiety and depression scale and the depression, anxiety and stress scale and so on were kind of used maybe once or twice each. If you put them all together, that's quite a lot of people who are using mental health measures for well-being. So I think that kind of ties with one of the main messages from this review. And I know that Nicola mentioned that you talked about well-being last week and what mental well-being actually is, or psychological well-being. And I wondered if anybody would like to kind of offer up a brief summary of what you talked about and how that links with what I've just been saying.
I think all we said last time was very similar to what you said, differentiating between symptoms of mental health difficulties and a broader construct of well-being, and how that kind of has implications for the support you provide in universities.
Yeah, that's absolutely right. And that's one of the key messages that's come through in Michael Barkham's work and the SCORE project more generally. They're, and in fact in the Student Mental Health Charter as well, as I'm sure you'll know, Michael, they do talk about the idea that if you conflate mental health and well-being, then the kind of rates of poor well-being or poor mental health become difficult to kind of delineate, and it becomes difficult to know where to put resources for more kind of universal approaches, which are more for well-being and kind of prevention of mental health difficulty, perhaps. And people who are actually really struggling with the symptoms of things like depression and anxiety and eating disorders and so on. And I should probably say that Michael was involved in this, and he did a great job. If it is the same Michael, of course, it sounded like him.
Yeah, it is. Yeah, thank you very much.
That could have been embarrassing. That is absolutely true, is that this kind of, the lack of separation makes it difficult to kind of know how best to support people. And I guess another key message from what we found in this review is that a lot of people are measuring well-being and they're talking about well-being, but they're not really using a theoretical framework. So their kind of selection of the indicator measure that they've chosen hasn't really been guided specifically. And you might imagine that if they're looking at kind of factors that are related to well-being, for example, you might imagine that some domains of well-being might be tied to different factors, because some measures talk quite a lot about like psychological functioning and kind of life satisfaction, like I say, whereas others are much more about emotion and how somebody's feeling, and that's not often driven the selection of the measures. I don't know if that's something you've all found if you've been reading kind of student mental health and well-being literature.
Hi there, it's Laura Bigart from UEA here.
Hello.
Hi, this is really interesting because my PhD student, Megan Jones, is doing a validation study on the Enlightened app at the moment.
Yeah, I know of Megan actually, yeah.
Yeah, so which is proposing to be measuring well-being, and we're wrestling with all of these issues right now because she's looking at theoretical frameworks, looking at the measures that currently exist that have been validated, and then trying to match them with the questions that are being asked. And actually, the questions being asked are much more around kind of a flourishing sort of theoretical framework than anything else that we can find. And I don't know if you've considered that. That's obviously on the sort of non-clinical side of things.
Yeah, well, the flourishing scale did come up. It was one of the 25, the specific Diner flourishing scale. And actually, interestingly, that scale was initially called the psychological well-being scale or something like that. I can't remember exactly what, but it wasn't initially specifically called flourishing, because it bring together a lot of constructs that are based around leading frameworks of psychological well-being. I'm not quite sure why the name was changed specifically. And I think that you often find the word flourishing being used when it comes to students, because it's kind of like, how can we support students to flourish in a nutshell, but to kind of achieve what they are capable of achieving and kind of develop approaches to support them to do that in line with the kind of pressures that come along with university. And I guess it's quite a nice one and a nice word, because it's very distinct from mental health. Because if you talk about mental well-being, then even just the inclusion of the word mental or psychological, I think, often makes people kind of think down a clinical route. And of course, both the WEMWebs and the GP core themselves have got questions about mental health. They do ask about experiences that are highly linked to depression and anxiety. So yeah, the flourishing one did come up in my search.
Great.
I think I might have actually had a chat with Megan, but do feel free to tell her to get back in touch if she's got any queries.
Yeah, I will. She couldn't make this morning, otherwise she would have sat in as well.
Yeah. Nicola, was there anything in particular that I've not picked up on that you can kind of remember from our discussions of this and from your reading and helping with the drafting of the review?
Oh, Alyson, you've already given us a really interesting summary. Thank you.
No worries.
I guess one of the points I'm picking up, I guess you've touched on this already, but I've played with this a lot in my mind, that there are these different conceptualizations of well-being, and we've looked at that it's not just in the measures for student mental health. This is murky right across the piece.
Yeah.
What, I guess, can you give us an idea of the different types of conceptualizations that you've seen in the measures of student mental health, and any thoughts on why that variability is challenging?
Mm-hmm. Yeah, no worries. So I think that the main kind of frameworks that have been used, maybe not even to guide the selection of the measures by the researchers, but have been used to guide the development of the measures in the first place, are around the notion of, like I was saying, subjective well-being, which typically has those two components, cognitive and affective. Mental or psychological well-being, which seems to be a catch-all term for a range of questions that ask about anything from life satisfaction to how somebody's feeling, to how they feel they're getting on in their day-to-day life, to their relationships and so on. So quite a broad brush kind of range of items. That also, like I say, can capture questions that are around mental health, I would say, but usually not a kind of overbalance of those in relation to more kind of well-being questions. And then I would say that the other main conceptualization is that poor mental health can be measured by virtue of having a high rate of mental health symptoms. I think those are the kind of three key frameworks that have come up. And then lots of different constructs from the positive psychology literature. So things like flourishing, like Laura mentioned, although like I say, that was initially actually constructed as a psychological well-being scale, as a kind of more broad measure of well-being, and resilience. And then a lot of things that are, like I say, indicators of well-being rather than measuring well-being per se. So social support and loneliness, things that some of us might say were more like factors that influence well-being rather than being a measure of well-being. And because there's this huge range, both in terms of conceptualization of well-being and then how it's being measured, it does make it difficult to obviously compare across studies, and I think that's one of our key aims with SMaRteN, is starting to move towards some recommendations that we can make, or at least some guidance that we can create to help people make kind of evidence-based decisions around if they're doing a cohort study with students or they're evaluating a wellbeing initiative, using similar measures that have got particular strengths for use in students, so that there can be greater comparability across different trials of interventions or studies looking at predictors of wellbeing and so on, and also for universities themselves as well. And I know there's obviously a huge drive for this specifically within counselling services, and that's what, are you all aware of the SCORE project, or are some of you?
Could you just outline it for us, Alyson?
Yeah, so that's separate. Emma Broglia, who's on the SMaRteN leadership team, is a big part of that, and it's specifically around looking at how they can standardise measurement of mental health. I mean, it is probably more about mental health because it's for within counselling services. So that's to kind of make sure that to try and standardise what counselling services are using, so that data can be used across the piece a bit more readily. And I guess from our perspective, we're slightly more trying to look at this on the research side of things, or if universities are kind of more broadly outside of their counselling services wanting to look at wellbeing, being able to put something together that can help to guide people to make informed decisions around measurement, and maybe give a bit of background to actually what well-being really means in the literature, because of course there are lots of different disciplines that are interested in well-being, and I have to say our review, just by virtue of the type of search terms that we used and the measures that came up, is kind of more social sciencey, I would say. I realised that in terms of health economics would be completely different measures. We didn't pick up any more kind of health economics measures or anything like that in our review. So yeah, that, I guess they complement each other very well, but it's just a message across the sector is that we need some kind of consistency. A bit like in health research, where you've got core outcomes that you use for specific conditions or populations. It would be good to move towards something like that for students, and there are a number of different projects, not just ours, that are looking into that in different ways.